Good morning, and thank you for having me here today. Again, my name is Leigh Purvis. I'm with AARP's Public Policy Institute, and I have been asked to provide a consumer perspective on some of the prescription drug price trends that we have been seeing lately. So I'm going to start off with why is AARP so concerned about this issue? It's a very simple answer. It's the prices. We really have become kind of the proverbial frog in boiling water, in the sense that just a few decades ago, we were experiencing a huge amount of public outrage about drugs that cost $10,000 per year. We now have drugs with prices that are around $2.1 million. So what we've done is basically gone from the price of a relatively reasonable used car, which some people would already say is too much, to the price of a 5,000 square foot house here in Washington, D.C. This is obviously something that's going to capture people's attention. We're also extremely concerned by the fact that all of the research indicates this is really just the tip of the iceberg. And if not based on the trends that we've already seen, the reality is a lot of what we're seeing in the pipeline are more and more of these products that are going to come on the market with six-figure or more price tags. We're also seeing a lot more emphasis on products that command high prices, so things like biologic drugs, orphan drugs, personalized medicine. We really are approaching an era where a lot of the drugs that are coming on the market are going to be coming on the market with prices that could potentially be even more eye-popping than what we're seeing today. And of course, as if the launch prices weren't bad enough, we also see prices continue to grow after these products enter the market. AARP has been tracking the prices of widely used prescription drugs since 2004. We have consistently seen price increases that exceed inflation from anywhere from twofold to 100-fold. We're also seeing these types of trends for specialty drugs, which are already expensive. We found most recently that the average annual price for one specialty medication used on a chronic basis was around $79,000 in 2017. We also took a look at how price increases can impact prices over time and found that the average price would have been close to $50,000 less if price increases had not exceeded inflation between 2006 and 2017. We are, of course, cognizant of the fact that we represent the segment of the population that uses more prescription drugs than anyone else. Part D enrollees use an average of 4.5 prescription drugs every month. They also tend to be treating chronic conditions. So we always like to point out that the people we represent are not facing a one-time high drug cost. This is something that they will be facing every single year for the rest of their lives. We're also very aware that the people we represent really do not have the financial resources to absorb the costs associated with prescription drugs. The median income for Medicare beneficiaries is just over $26,000 per year. A quarter of them have incomes of less than $15,000 per year. And they also don't have a lot of savings. One quarter have less than $15,000. So if you think about being prescribed an incredibly expensive prescription drug, the reality is this population simply does not have the resources to be able to pay for it. We're also very cognizant of the impact on the programs that our members rely on. Medicare Part B as in boy, which covers prescription drugs that are administered by physicians, spending has more than doubled between 2005 and 2017. Under Medicare Part B, beneficiaries are responsible for 20% of their costs. There are some beneficiaries who are facing cost sharing of over $100,000. Going back to the median income of $26,000, obviously that is not something that they're going to be able to pay. A lot of people will come back to me and say, yes, everyone has supplemental coverage, so we don't have to worry about that. But the reality is the costs covered by supplemental coverage do not just disappear into the ether. They will be built back into the premiums of that type of coverage and could eventually make it unaffordable. We also obviously are keeping an eye on Medicare Part D as in dog, which covers drugs that are picked up at the pharmacy counter. Medicare Part D spending is approaching $150 billion a year. Under Medicare Part D, there is a catastrophic cap. However, it's not a hard cap, at least for now. They're still responsible for 5% of their costs even after they enter catastrophic. So we have enrollees that are facing annual costs of over $10,000, even though they are technically in catastrophic coverage. Again, going back to $26,000 per year, that obviously is not something that anyone's going to be able to pay. We're also very cognizant of the impact on Medicaid. That program is covered by federal and state, and the reality is state budgets can't borrow. They need to balance their budgets. So when you're looking at the Medicaid program and you're looking at these accelerating costs, states really are caught in a position where they're going to have to start making trade-offs, whether they're paying for prescription drugs under Medicaid or paying for other important services that they provide. We're also cognizant that private insurance is being impacted by this. More and more employer-sponsored coverage is starting to kind of replicate what we see under Medicare Part D in the sense that we have more and more tiers with more and more high cost sharing. Things like co-insurance, which you've heard about already, where you're paying a percentage of the drug's price as opposed to a flat copay. We're also seeing more and more plans with high deductible health plans where people are directly exposed to high prescription drug prices. Yes, there tends to be an out-of-pocket cap, but look at these numbers. Is anyone in this room willing to pay that kind of money every single year for the coverage that they need or able? The other thing we always want to be mindful of is this is an issue that touches everyone. Whether you are taking a prescription drug yourself and paying for it at the pharmacy counter, you're paying for this as someone with health coverage. You're paying for your premiums, your cost sharing. Those costs are being built into something you are paying. You're also paying as a taxpayer. I mentioned Medicare, Medicaid. Those are taxpayer-funded programs. So I think the most important thing to keep in mind is this is an issue that touches every single person in this room, regardless of whether you're taking a drug yourself. So what do consumers think about this? I think it's safe to say that consumers are ready for change. I don't think there is another issue in this country where there is such a high level of agreement in terms of the fact that something needs to be done about prescription drug prices. They say they're too high. They say that prescription drug companies are making too much profit. They blame high prices for high healthcare costs. And they say that it's incredibly important for politicians to do something about this problem. So I think, again, very safe to say this is an issue that resonates and something where there is a high level of public support for something to be done. They also support a very wide variety of solutions. These are just some of the surveys that have been released lately. They support pretty much anything they think is going to have an impact. This is an issue, again, that resonates. There are a lot and a wide variety of ways to attack this problem, and there is wide public support for a lot of them. More in relation to what we're discussing today, I would say that consumers are very aware of the costs associated with R&D. There's a reason that that sort of messaging is used in talking about anything that might potentially reduce prescription drug prices. It's because people want R&D to continue. That is definitely an aspect of this problem that people understand, and it resonates with them. However, there's not a whole lot of evidence about the fact that they understand their role in R&D. Although I have noticed a larger number of articles that are, and here are some of the titles of them, that are actually dealing and trying to help educate, I think, on that particular aspect of this issue. So what's the path forward? I think this is definitely an issue where more consumer engagement would be helpful. Going back to the fact that everyone is touched by this issue, I think helping people understand that their role in R&D, their taxpayer contributions to R&D, could help people understand this is an issue that needs to be resolved and something that can, again, help engage them further on the issue. I can say that I have seen a relatively small amount of evidence in terms of whether they support policy solutions that would deal kind of with the NIH underlying research and development, things that would be like limiting patents or requiring that a certain percentage of spending needs to be spent on R&D for drug companies that do receive these types of benefits. And I will also say that going back to the solutions that are supported, fairness is definitely something that appeals to Americans. And I think the idea that taxpayers are contributing to R&D and that they're effectively paying twice for these drugs is something that I think would resonate with them as well. If nothing changes, I think regardless of where prescription drugs are originating, the reality is that current price trends are simply not sustainable. There is no way that people or programs can continue paying the prices associated with prescription drugs that are coming on the market today. And doing anything really to help bring down those costs could result in billions of dollars of savings. I think the other thing to keep in mind, I know that innovation is a recurring theme on this topic. Yes, everyone absolutely wants innovation to continue. Our members want innovation to continue. They benefit a lot from prescription drugs. But the reality is that the innovation that's coming will be meaningless if no one can afford to use it. Thank you.
Thank you very much.